It's a story that has become all too common for patients living with a chronic illness. They are diagnosed with a condition and then are given new medications, new dietary restrictions, and new recommended lifestyle habits, leaving them feeling confused, overwhelmed, and wondering how will they manage what is now their new normal.
One doctor told me I had COPD, and the other told me I had CHF, and for each one, medication was prescribed. And I didn't know what kind of interaction there could be between these two. I didn't think the doctors were in tune with each other, and that really stressed me out.
Although it can be overwhelming, medical experts agree that patients living with one or more chronic illnesses, such as COPD, diabetes, or congestive heart failure, should take a proactive role in the management of their disease.
You really need to take control of your healthcare just like you do of your finances or anything else in your life. You need to be the one making the decisions, and you need to be able to understand that your own choices affect how well you do in the healthcare system.
However, it's not just the self-care management for patients navigating through and understanding medical records. Coordinating care with multiple record providers and scheduling a series of visits in multiple locations can also pose a serious challenge for patient care.
My experience was I went to different hospitals, different doctors, I had different records. I needed people to take me around. There wasn't anything that was even remotely empathetic about my situation.
Intelligent and empathetic characters on mobile devices are emerging as revolutionary health coordinators and advocates for patients, their families, and their healthcare providers. Unlike other health applications, artificially intelligent avatars can learn from the patient and get smarter and more helpful, with each conversation building an engaging relationship.
So mobile applications, and there are many of them out there now, allow you to keep track of things, and they allow you to see how your behavior, how your activities are affecting your life. A good example is things like Fitbits or Apple Watch or other types of devices combined with mobile apps. What we do is we go one step further. We actually evaluate your emotions, we evaluate your environment, and we combine all of these things to give you a sense of how you're feeling in addition to how you're doing.
Intelligent Digital Avatars Incorporated, IDA, has developed the first empathetic, intelligent, and conversational avatar app, Sophie, powered by IBM Watson. Sophie was created to promote patient engagement, manage chronic conditions, and ultimately improve healthcare outcomes through a series of interactive and intelligent one-on-one conversations with the patient.
An avatar like Sophie is able to track you and track you several times a day. And if your vitals are deteriorating or things are getting worse, she's able to alert the doctors or the care team. One of the questions I often get asked is why an avatar? And what's really important about an avatar is that people feel that they can trust a virtual character actually more than a human being. And that's very surprising. The research shows that an avatar doesn't judge. One of the biggest fears that people have is whatever I say, I'll be judged on that. So not having that judgment factor and also having the patience of an avatar that you can ask the same question 5 times and somebody isn't going to be irritated because you don't get it, you don't get the answer. Those are the 2 most compelling reasons why people like talking to avatars, even preference over human beings.
Better overall patient coordination and care results in lower costs, better health outcomes, and most importantly, can increase the quality of life for patients and their families.
What's really important is that you gather the information about your patient before you actually get to see them. Right now, the crunch in terms of the amount of time you can spend with the patient means you don't have enough time to ask all the questions. But imagine if all those questions were asked at home and all of that was available to you and summarized in a useful manner before you saw the patients. We're very excited because we are not only in healthcare, but we're starting to branch out into self-service. So this gives us an opportunity to work with people who get onto a website and have questions or want to learn more about certain types of information that's not readily available to them. So when you do a Google search, you get an awful lot of information, but how do you know what's really relevant to what you have? So people go to a website and they search and they look and they search and they look and they search. Well, what an avatar can do for you is to pinpoint the information that you want and give you the level of information that you want. So maybe you get a short summary, or you get to read the entire white paper if that's what you're looking at, or you want more information, you're able to click on and get to see an entire video. More importantly, when you see the video and you have questions, the avatar is able to answer those questions now. So from an education standpoint about whether it's a product or health or financial services, you're now able to be more of a do-it-yourselfer. And we have statistics that show that without the avatar, about 15% of the time people are able to get what they want. With the avatar, it averages over 80%. So that's a huge savings for companies that want to be able to promote their products or to be able to provide information about them. So we're very excited.
To learn more about iDAvatars, please visit them online at www.iDAvatars.com or email info@iDAvatars.com.